Hi, I'm Dr. Shwetha and I'm the Managing Director of Janisthaa Fertility Center and Hospital. Janisthaa is a fertility center which is located in Basveshwar Nagar, Bangalore. There are a lot of speculations around the baby is born after IVF, whether they are normal, they're not normal, what are the abnormality rates, what happens during pregnancy, what is the effect after birth. So these are the questions which generally, suppose if I were to be undergoing IVF, probably I would have thought about it a million times. So when we visit a playground and see plenty of children playing there, can you identify the child who is born from a normal pregnancy, and can you identify a child which is born from an IVF pregnancy? We really can't differentiate between these two. But then now when we are towards the assisted reproductive technologies, we are going against nature. And definitely we have to, it is not as normal as the regular pregnancies. But the difference is, the abnormality rates in regular pregnancy is about 4%. But when you do IVF, the abnormality rate in the babies is about 8%. So the rates are not too high for people to think about it. And secondly, people feel that IVF babies, the activities may not be that good, maybe their IQ level may not be that good, but then there have been studies, there have been follow-ups done from the IVF born babies, and they are on par with the normal children who are born out of normal pregnancy. And the recent thing is about autism. I think there are few papers which came up saying, okay, IVF increases the risk of autism and then things like that. But when we look back the previous papers and so many studies which has been done, autism risk is not related to the IVF babies. IVF as such, the pregnancies, because they would have had some intrinsic issues, and that is why they wouldn't be able to conceive on their own. But then after doing an IVF, definitely there would be little more chances for miscarriages, more chances of developing sugar, that is diabetes and hypertension, and sometimes preterm deliveries. So these are the risks which are associated with IVF, little more than the normal pregnancy. In normal pregnancy, probably all these risks could be about say 10%. In IVF pregnancies, it could go as high as about say 20%. So the risk is there, but it is marginally high than the regular pregnancy. It is not that it is exactly dropped 2 times or 3 times more. So IVF is one of the safe methods to have pregnancy, and once you are pregnant, it has to be monitored in a proper way to have an ideal outcome.